3 steps to get that knee train on the track. So let's review what we've learned so far about the knee. So if you have pain in the front of your knees, it could be that patella, that kneecap, and where it's located inside the grooves of the femur, much like a train on its tracks. If the position of the femur isn't quite right, then that patella bumps up against the edge of the track and it creates pain. It creates irritation. So I'm going to talk about 3 ways that you can get the train back on the track. I'm Stephanie Carter-Kelly, a physical therapist that uses yoga in everything that I do. And if you like this, you're going to love all of my classes for knee pain. It's a bundle of classes that I've put together called Nourish Your Knees. It's 6 classes and a few anatomy lessons so that you can really get a handle on what's going on with your knees. Whether you have this patellofemoral pain, whether you have arthritis in your knees, you've already had a joint replacement, it's okay. These classes are perfect for you. I start from a low level. I build in all the education just as I would in a physical therapy episode of care. Like if you go to physical therapy, you're getting a lot of education. So it's all built in. You're exploring your body and your knees every step of the way. So let's talk more about how to nourish those knees, especially the pain that you have right in the front of the knees, whether you're going up and down stairs or getting up and down out of a chair. Maybe if you sit for a long period of time, when you go to get up, you really notice that knee pain right in the front of your knees. So the first thing that we need to do in order to get that train on the track is build capacity. What do I mean by capacity? Capacity means that you've got good strength of not just your thigh muscles, but also of your hip muscles. And it also means that you need to have adequate range of motion. I sit here on my knees. How many of you can sit in this position on your knees and have full knee flexion range of motion? How many of you can, float that knee on nothing, kind of suspended in the air, and get full extension range of motion strongly? So you need to have full range of motion, whether it's an extension, working it to get it nice and straight, or flexion, and you don't have to, sit on your knees like I did, but you can come to this position and stretch the muscles around the thigh in order to get heel to bottom and lengthen. In the videos that I did last week, I talked a lot about how to gain that mobility in your knees. That's all about building capacity. We talked about building the quad muscle, the hamstring muscle. But if we are really interested in the track, the train on top of the track, a lot of times it's the track that's out of position. It's not the patella, it's not the kneecap, it's the track. So we need to come up into the hips and strengthen the muscle of the hips, especially the glutes in the back of the body, the gluteus maximus, and also in the sides of the body, gluteus medius. So I'm going to give you 3 exercises to strengthen those hip muscles. That's really where we want to focus when we're trying to get the kneecap to track properly inside of the grooves of the femur, the large thigh bone. So number 1 is clamshell. And you might know this exercise, you might have done it before. So you just lie on your side. You can always prop your head with a pillow. I'm just going to use my arm. Your knees are bent in a nice zigzag position. You're almost in a thunderbolt position. Feet are stacked on top of each other. Feet are going to stay together. It's the knees that are going to come apart. And you're going to hold this position. And you want to make sure that as you hold that position, just see how that feels first before you ever do a lot of repetitions. You might lift that leg and then immediately feel like there's some effort and some fatigue there. I like to do isometric holds first because people can get a lot of excess movement if they're trying to do repetitions where they're moving the leg. So if you feel like you have a little bit of strength and you can move that knee up and down, you want to make sure that your torso stays nice and still. You can put a hand right here on top of the pelvis to make sure that the pelvis is not moving back and forth, that the pelvis is still and the thigh is what is moving. Okay, so that's the clamshell. The second one, that top leg goes nice and straight. I'm just going to rest it on this step. Usually you would let it rest onto the floor, but you want to look and make sure that the thigh is in line with the torso. If I have seams on my pants and on my shirts, I want to line that all up. Pants and shirt, line the seam up, and make sure as you lift your leg that you're lifting from the heel and you lift up towards the ceiling and back just a little bit. You want to target that gluteus medius muscle right on the side of your hip. So again, you can just up and hold that position. You'll feel the burn. Or you can do repetitions within a range of motion, whether you're going all the way down to the floor. You don't have to go high. The biggest challenge is when that leg is straight or parallel to the floor. That's the biggest challenge. So you can lift it up and just do little pulses. That's a big challenge. But overall, you want to build some strength in the sides of the hip. And these are all just starter exercises. You eventually want to make sure that you're doing exercises to strengthen these muscles while you're in standing, because that's typically where the pain occurs. You have to progress up to the weight-bearing exercise. The last one is bridging, working the gluteus maximus muscles. The knees are bent as far as you can bend them back, push into the heels, lift the hips, trying to get a nice straight line through the torso as you lift. And again, you just want to really feel this in the gluteus maximus, those big muscles of the bottom. And you can do repetitions, or you can just up and hold. And again, this is just a starter exercise. You really need to progress these muscles to challenge them and make sure they're strong enough to carry the load of the body. That's what these muscles do, carry the load of the body. Those are 3 good starter exercises, because building capacity is just the first step. Now, if you have already been on this path, say you've already worked with a physical therapist and you have worked to build some strength, you've worked to get some range of motion, but you still feel pain in your knee, we're going to get to the next 2 steps. But the other thing that may help you in building capacity is to relieve some of the tension, not just from the muscles, but from the nervous system. If your nervous system is in chronic overdrive, in that sympathetic overdrive all the time because of the stress that you experience from day to day, it's going to be really hard to train those muscles effectively. It's going to be hard to gain the range of motion that you need in that knee and in your hip if you're always sort of tight and tense. Not because of your body, but because of your brain. So you might just want to take a look at, how can I make sure that I'm starting with the right environment of my nervous system in order to build capacity in strength and also in range of motion. Okay, so that's number 1, build capacity. Make your body ready and prepared to start the other things. So the next thing is use some external feedback to change the way you move. So let me talk about that. I'm going to back up here a little bit. Actually back up, not go forward. There we go. Okay, so you want to put yourself in front of a mirror with a chair to do stand up, sit down. Stand up, sit down. And you want to do this a few times. You want to do it enough to get fatigued, because a lot of times it's how we move when we're a little bit tired, not necessarily when we're fresh. But you want to pay attention to what's going on with your knees. You want to push those knees out, and you want to look at yourself in the mirror to make sure that you're doing that. So pushing the knees out as you sit. Don't let them pinch together. And you want to do that as many times as you can. You want to do quick ones. You want to get really fatigued. You can do a lot of these. Now, if you have some pain, you might want to modify the height of the seat. Start high and work lower. That's a progression. But think about pushing those knees out and watching yourself, giving yourself that feedback to make sure that you're doing it correctly every single time. A way to progress that. So, and you'll get tired. I'm a little out of breath just from doing sit to stand. So a way to progress it is get the seat lower. Maybe you don't actually sit down. Watch how much you have to rock and get momentum. The more you can work from the strength of your legs, the better. But the goal here is that you're keeping those knees pushed apart. So to progress that, you want to come to a step. And again, look at yourself in the mirror and make sure that as you do your step up and down, or whether you're just facing a step and going up and down, you want to make sure you're pushing those knees out to the side, and that as you lower yourself or as you step up, you're not seeing this kind of motion. You don't want to see that knee dive in. That's what's common, and that is where the kneecap, the train, is going to push up against or bump up against part of the track and cause pain. So watch yourself in the mirror and push that knee out and overdo it a little bit just to give yourself, that training of pushing the knee out while you're going up and down. Number 3. So when you're looking in the mirror, you're giving yourself some external feedback about what's going on. But ultimately, you want internal feedback. You want to be able to feel what's going on in those knees as you're moving. And then eventually you don't want to have to pay attention at all. But we have to start by looking and then take the mirror away, do the same exercises. One of the best ways to get internal feedback about what's going on is how does it feel? You will notice, I can change the symptoms in a person's knees very quickly by giving that feedback about where the knees should be in space. And sometimes I have to play with it a little bit, and there are occasional times when it doesn't help. They just need to build a whole lot more capacity before we change how they're moving, and that's okay too. But once they can feel it inside themselves, then I know I've got it. When they can self-correct because they feel a pinching, a little bit of discomfort. So you actually use the pain or what you feel in your knees as that internal feedback to make the change. So this comes back also to the process of yoga where we're practicing awareness. You want to be really aware of how that knee feels. So many times when we're in pain, we block out the sensations of what we feel and we just ignore those sensations and we push on through day to day. I'm asking you to pause and really pay attention. I'm telling you that you have the control inside of you to make the change in how those knees feel with every step that you take. But you have to go through these steps in order. You have to build capacity of the thigh muscles, of the hip muscles, even of the foot and ankle muscles in order to really support this very vulnerable hinge knee, sort of stuck in between two areas. And then you have to use external feedback and really work to change how you move, especially when you're fully loaded. So sit to stand or stepping up and down. And then you have to feel it internally. You have to know to make the change. And eventually, with practice, over time, this could be a 3-month process, honestly. You're making changes in the brain. And even though the brain it's called neuroplasticity, it has the ability to change. It takes practice, frequent, consistent practice over time, which is many times why people give up. They don't stay at it quite long enough. So I hope these this helps because it's not all about just building strength. You may have already tried to do that, but it's actually more about training you to move in new ways. Create new ways to move. That is the process that I call peace out of pain. It includes all of these steps. And you can learn more about this process if you join this, get this bundle of classes for your knees. Nourish Your Knees. It will take you step by step through exactly what you need for the health of your knees. And the classes are meant to be repeated over and over and over again, right? If you've been to physical therapy, you know that you repeat the same exercises. And you go home with that piece of paper and you think, okay, what did they tell me again? Well, I've done it all for you. It's all in these videos. So go ahead and grab them. Again, I'm Stephanie Carter Kelly, a physical therapist that uses yoga, which brings some of that like awareness, some deep breathing, caring about the nervous system. That's what yoga brings to this practice of physical therapy and healing for you. Have a great rest of your day. Namaste.